Let's keep that conversation going because some health experts say all the smoke from the wildfires is doing serious harms to our bodies. So let's bring in NBC News medical analyst Dr. Vin Gupta for a look at how these smoky skies can impact our health. What are, Dr. Gupta, some of the immediate effects that wildfire smoke can have on our bodies, especially our respiratory system?
Yeah, Joe, good morning. Sam teed it up beautifully. And really, the concern here is if you're breathing in these fine particles that you can't see with the naked eye, but you can smell, certainly your body can feel it. It causes inflammation in the airways and really causes something called bronchospasm in somebody, even healthy individuals, but particularly if you have asthma, if you have emphysema from, say, a history of smoking. This will exacerbate that and cause your lungs to really react. And so that's number one. We worry about that. We see increased rates of hospitalizations, ED visits in the setting of poor wildfire smoke amongst those with underlying lung disease. So, Joe, that's the main concern.
At what point, doctor, should you seek medical help if you know that you're being exposed to smoke from wildfires?
Yes, Savannah, really important for people to realize that it's the same set of symptoms, red flag symptoms that we worry about just in general. So if you can't catch your breath, if you have an oximeter, we used to talk about that a lot during the pandemic, and you measure your oxygen, say it's 92% or less. You just feel like you can't do things that you normally could do, just walking on level ground. Those are chest pain in particular, or just, again, you can't catch your breath. That's when you want to say, let me go get seen. Let me figure out what's going on.
This has been happening more and more over the last couple of years. Are there any long-term health effects that we should be worried about?
Yeah, Joe, I'll say just in the last 5 years, there's been big studies showing that just air pollution, chronic air pollution is the fourth leading risk factor for early death and disability worldwide and in the United States. So it's an independent risk factor. So chronic exposure, what does it do? The lungs, obviously, it impairs lung function, heart function. It can really worsen heart disease. But what we're also seeing is that it can accelerate aging. It can lead to increased rates of dementia, and it can decrease immune system function. So there's a lot of unexpected consequences, I think, for a lot of people that we're now noticing because of chronic air pollution.
Doctor, also this can impact our brains, I know. What are some of the ways that it can have an effect on our mental health, just the toll it takes kind of dealing with this for a prolonged period of time?
Yeah, Savannah, this is the area of research I think we're learning a lot more about. But what we've seen now is this focus on indoor air quality as a result of what's happening outside. And what we've seen is that amongst kids in, say, elementary schools, if they're exposed, if that building does not have great ventilation systems, and say there's a wildfire happening outside, we've seen actually a decrease in test scores, decreased cognitive function, even amongst children chronically exposed to poor air quality for whatever reason it may be. Amongst older adults, again, we've seen this link between chronic exposure to air pollution and, say, increased rates of dementia. Say if somebody lives in an inner urban city next to a transportation hub, or if they're exposed to wildfire smoke for prolonged periods. And so there is a clear link here between cognitive function across age groups, Savannah, and exposure to air pollution.
Dr. Vin Gupta, so many impacts to keep in mind. Appreciate you joining us this morning. Thank you.
Let's get the latest on what's next here for all this extreme weather so that you and your loved ones can stay prepared.
Meteorologist Amelia Draper from our DC affiliate WRC joins us with your Morning News Now forecast.